Hello, my name is Jacob Alvarez, and I am a 26-year-old Hispanic student graduating in April 2023 from Western Michigan with a Bachelor of Science in Nursing and a minor in Spanish. Currently, I work at Bronson Methodist Hospital in downtown Kalamazoo as a nurse extern on the Cardiology unit. My job is similar to the clinical rotations I've already completed in nursing school in that I am paired with a registered nurse for 12 hours every shift, and we work together to bring our patients effective nursing care. When considering my signature pathway, I wanted one that aligned with my core values, promoted effective, individualized healthcare to each of my patients, and that could teach me how to elevate my abilities as a registered nurse. I've chosen the diversity, equity, inclusion, and justice pathway. I'm not from Kalamazoo, I'm from Flint, Michigan, and I am not inheriting guidance or advice from my family about how to pass nursing school because I'm the first person in my family to pursue a career in healthcare. I'm not just looking to complete my final year at WMU, I'm the Vice President of the Student Nurses Association at WMU and have maintained a competitive GPA. I am blessed to have such a unique background and to have accomplished my goals while remembering where I come from. As a distinctive male Hispanic nursing student, many of my past opportunities to verbalize my diversified viewpoints or to help create solutions are often overshadowed by people in higher positions who also happen to be white. I chose this pathway because I want to learn how to combine my background and upbringing, along with my education and core values, into nursing. Since I chose my pathway, I have learned how to bring radical acceptance into my personal life and discussed innovative methods to support and nurse patients from many different backgrounds and cultures. I chose my externship at Bronson for my signature experience. This has been one of my favorite jobs that I've held, and it has exposed me to so many hospital culture norms, unspoken expectations, and has sharpened my clinical decision-making. I am grateful every shift to have the opportunity to perform clinical skill sets, and additionally, my signature experience has elevated my mindset from let me get through this 12-hour shift to how can I use the time I have left to make my patient's day and create individualized interventions for them. My education and training provided by Western Michigan have been tested on campus through quizzes, homework assignments, exams, or simulation labs, and off campus like at clinicals or when I'm volunteering in the community. My education from Western Michigan is a one-of-a-kind opportunity as there is a holistic nurse eligibility acquired with my degree too. Western Michigan University has shown me how no two patients are similar even if they have the same disease processes or are of the same age. Throughout nursing school, I've created many care plans revolving around my patients' needs, and the feedback I've received from these assignments has validated my creative ideas for holistic interventions. While at WMU, I have been a part of many organizations that have aided my fulfillment and satisfaction as a student at Western. I was on the Bronco drumline for 4 years, and when I'm starting to notice feelings in myself of stress or tension while I'm at work, I benefit from connecting some of the lessons I learned through the Bronco drumline to my nursing care. I remember the cruel expectations on how precise our performance had to be and how hard we practiced outside in the snow and the rain. I also remember how the adverse conditions and circumstances we endured brought the drumline together as a team and as a family. We relied on each other for guidance and for support. Friendship came easy when we combined our strengths towards the same goal of becoming the best drumline we can before the season is over and no trophies were required. My signature experience has had a beneficial impact on my ability to nurse, improve my confidence in my clinical skills, and has enabled me to grow interpersonal connections with healthcare workers. Sharing useful information that I found within the patient's medical records with my nurse, asking the patient more about their background, collaborating with my nurse to create an individualized care plan for each of our patients, and implementing it typically improves patient health and staff morale. My pathway of diversity, equity, inclusion, and justice, along with my education, has helped me routinely achieve my self-assigned clinical expectations every shift. My signature experience, working alongside multiple RNs, has given me a safe place to talk about my ideas for improving healthcare systems, where my limits are, discuss my intentions for each shift, and has created a very important foundation of trust between me and healthcare workers. I have witnessed smiles and a sense of relief for my patients when I can take care of their holistic and medical needs by incorporating my personality, my pathway teachings, and my education into my signature experience. I'm staying employed at Bronson until I graduate, and then I hope to begin my career near Grand Rapids. As I begin my career as an RN, I plan to maintain a beginner's mindset, seek to understand with a non-judgmental attitude, and continue to learn how to provide culturally appropriate healthcare to diverse populations.